Mr. Kim. My name is Shawnee. I'm a student nurse that's been working with you. We have an order to do draw some blood, and with that, we're going to do a dressing change and cap change on that central line. Okay?
Okay.
Have you had this done before?
Yes.
You have? Okay. Well, I just want to remind you, we do this every 7 days, every 96 hours when we're giving lipids, which is a fatty substance that we can give to you. If it becomes soiled or damaged, or if we need to draw blood like we're doing today, when we'll also change that cap, okay?
Okay.
Do you have any questions?
No.
And I just need to check your name and date of birth real quick on your wristband.
Guy Kim, April 12th, 1987.
Right, perfect. I'm just gonna go get everything set up and do some hand hygiene, okay?
Okay.
When washing my hands, I want to make sure I wash for a full 30 seconds, getting under the nails and then using all my fingers. Alright, so when we do this, I have this mask that I'm going to place on you. And this just protects the area from getting any germs. When I take the dressing off, this is going to be a sterile dressing change. So I just want to make sure that you keep your head turned away from your chest for me, okay?
Okay.
We also wear a gown. It just protects us from swapping germs and keeps everything as clean as possible. Okay. Do you have any questions so far?
No.
Alright, so what I'm going to do right now is I'm just going to take off the dressing. I also need to have a trash can available for us. Okay, so I'm just going to put on my gloves here. I just have an alcohol wipe that I'll use, and I'm just going to go around and loosen that up a little bit. Okay. I'm going to start to peel this off. It may be a little uncomfortable. It shouldn't hurt too bad. Just let me know. When I do this, I want to go from the out in. While watching that cord. And then I'm just going to look at the dressing, make sure, check what kind of drainage is, see if there's anything that looks like infection or anything like that. I'm also going to be looking at the actual insertion site, checking for redness, swelling, phlebitis, and just make sure everything looks great. So I'll go ahead and get rid of this. So next is going to be the sterile part. Just make sure to please keep your head turned away. Do a little hand hygiene here. With my kit, it's open for video purposes, but I know when I'm doing this, I want to have a fresh kit, check the expiration dates, and make sure it hasn't previously been opened. Alright, so I have my kit. I'm going to open it. And get rid of that. I have some gloves in here. Pull this to the side a little bit for now. So every time we just have to maneuver these a little bit. Okay, so I have my sterile gloves. Okay, so now I'm sterile. Normally a kit will come with a sterile drape. This one did not have it, so I can use the inside of my glove package if I need extra sterile surface area. If I did have it, I would pick up the drape, shiny side down, wrap it around my fingers, and then I could place it down away from me. So I'm going to go ahead and grab my ChloraPrep. I'm going to keep this hand up here, holding and securing the line. I pop this and I go ahead and start cleaning. I want to clean from the inside out, and I don't want to go over any surface area I've already cleaned. I go around. I want to make sure that I clean the line really well. Both sides. And then I can also do like a bigger area on the outside just to make sure I've covered my ground. I'm going to go ahead and toss this in the trash. And then if there was some blood on there, I could use my alcohol swabs, and I would as long as I hold this down here, I could rip the top off, pull out an alcohol swab, and go ahead and throw that in the trash. Come up here, and I could clean that part of the blood with the alcohol swab that I saw. Alright, so next we have our actual dressing change. So I want to make sure that I'm folding that back. I can use this hand to pull this away, throw that away, and I'm going to go ahead and place this. And since the insertion site is covered, I can use both hands now to take this part off. I want to date the time and initials written on here so that we know when it was last changed and who did it. Sorry about this, this one little piece just does not want to come off. There we go. Perfect. Alright. And now we're gonna go ahead and I'm going to do that drawing the blood and the cap change, okay?